Understanding and Navigating the Complexities of Schizophrenia, a Summary of Surviving Schizophrenia by Torrey. Surviving Schizophrenia, a Family Manual by Torrey, is widely regarded as one of the most comprehensive guides for understanding and managing schizophrenia. First published in 1983, and now in its 7th edition, the book offers valuable insights into the diagnosis, treatment, and long-term management of schizophrenia. Torrey, a psychiatrist with extensive experience in schizophrenia research and clinical practice, wrote this book primarily for families and caregivers of those affected by the disorder. The book serves as both an educational resource and a practical guide, providing a thorough exploration of the condition and offering strategies to help families cope with its challenges. This essay will summarize the key themes and insights from surviving schizophrenia, highlighting the critical aspects of understanding, treating, and living with this complex mental illness. Understanding schizophrenia. One of the primary goals of surviving schizophrenia is to demystify the illness for those who are directly affected by it, whether as patients, family members, or caregivers. Schizophrenia is a severe and chronic mental disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. Torrey emphasizes that schizophrenia is a brain disease, not a result of bad parenting or personal weakness, which helps to reduce the stigma associated with the condition. Torrey explains that the symptoms of schizophrenia can be categorized into 3 main groups: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms include hallucinations, delusions, and disorganized thinking, which represent an excess or distortion of normal functioning. Negative symptoms, such as social withdrawal, lack of motivation, and blunted affect, reflect a loss of normal functioning. Cognitive symptoms, which involve difficulties with attention, memory, and executive functioning, can be particularly debilitating and contribute to the overall impairment in daily living. The book also discusses the potential causes of schizophrenia, acknowledging that while the exact cause is still unknown, it is likely the result of a complex interplay between genetic, neurobiological, and environmental factors. Torrey presents evidence supporting the idea that schizophrenia is a brain disorder, with research pointing to abnormalities in brain structure and function, as well as imbalances in neurotransmitters, such as dopamine. He also explores the role of genetics, noting that individuals with a family history of schizophrenia are at a higher risk of developing the condition. Diagnosis and treatment. Surviving Schizophrenia provides a detailed overview of the diagnostic process, emphasizing the importance of a thorough evaluation by a qualified mental health professional. Torrey explains that diagnosing schizophrenia can be challenging, as the symptoms often overlap with other psychiatric disorders, such as bipolar disorder or major depressive disorder with psychotic features. He stresses the need for a careful assessment of the patient's history, symptoms, and behavior to ensure an accurate diagnosis. Once a diagnosis is made, treatment becomes the focus. Torrey advocates for a comprehensive treatment approach that includes medication, psychotherapy, and psychosocial interventions. Antipsychotic medications are the cornerstone of treatment, as they help to reduce the severity of positive symptoms, such as hallucinations and delusions. Torrey discusses the different types of antipsychotic medications, including first-generation, typical, and second-generation, atypical, antipsychotics, and provides guidance on managing potential side effects. In addition to medication, Torrey highlights the importance of psychotherapy and psychosocial interventions in the treatment of schizophrenia. Cognitive behavioral therapy, CBT, is particularly beneficial in helping patients manage symptoms and develop coping strategies. Family therapy is also recommended as it can help to improve communication and reduce stress within the family, which is crucial for the patient's recovery. Torrey emphasizes that treatment should be tailored to the individual, taking into account the patient's unique needs, strengths, and challenges. He advocates for a collaborative approach where the patient, family members, and healthcare providers work together to develop a comprehensive treatment plan. This approach not only improves treatment outcomes, but also empowers patients and their families to take an active role in managing the illness. Living with schizophrenia, the role of family and support system. One of the most significant contributions of surviving schizophrenia is its focus on the role of the family in the management of the illness. Torrey acknowledges that schizophrenia can have a profound impact on the entire family, not just the individual with the diagnosis. He provides practical advice for family members on how to cope with the challenges of living with someone with schizophrenia, including managing stress, setting realistic expectations, and maintaining open lines of communication. Torrey emphasizes the importance of education and support for families. Understanding the nature of schizophrenia and the treatment options available is crucial for family members, as it helps them to provide the necessary support to their loved ones. Torrey encourages families to seek out support groups and resources, as connecting with others who are going through similar experiences can provide much-needed emotional support and practical advice. The book also discusses the challenges that individuals with schizophrenia face in their daily lives, including difficulties with employment, social relationships, and independent living. Torrey stresses the importance of rehabilitation programs that focus on improving social and occupational functioning. He highlights the role of case managers, vocational rehabilitation programs, and supported employment services in helping individuals with schizophrenia to achieve greater independence and quality of life. The future of schizophrenia treatment and research. In the final sections of Surviving Schizophrenia, Torrey discusses the future of schizophrenia treatment and research. He expresses optimism about the potential for new treatments and better outcomes for individuals with schizophrenia, thanks to advances in neuroscience and genetics. Torrey highlights the importance of ongoing research into the causes and mechanisms of schizophrenia, as well as the development of more effective medications with fewer side effects. Torrey also advocates for greater public awareness and understanding of schizophrenia. He calls for a shift in societal attitudes towards mental illness, emphasizing the need to reduce stigma and improve access to quality mental health care. By raising awareness and providing education, Torrey hopes to foster a more supportive and compassionate society for individuals with schizophrenia and their families. Surviving Schizophrenia, a Family Manual by E. Fuller. Torrey is an invaluable resource for anyone affected by schizophrenia. Through his comprehensive exploration of the illness, Torrey provides a deep understanding of the complexities of schizophrenia and offers practical advice for managing its challenges. The book's emphasis on the role of the family and support systems underscores the importance of a collaborative and compassionate approach to treatment. Torrey's work has had a profound impact on the field of mental health, helping to educate and empower countless families and individuals living with schizophrenia. Surviving Schizophrenia serves as a beacon of hope, reminding us that with the right treatment, support, and understanding, individuals with schizophrenia can lead fulfilling and meaningful lives.